So this is a really good question. So today the maintenance in AML, so there is only two maintenance approved. So there is the Midostaurin for the FLT3 mutated AML, and there is the oral Azacitidine for the other patient. But the maintenance is given to the patient only for patient in CR and ineligible to allo stem cell transplantation or with good profile without need to undergo to allo stem cell transplantation. So it's not a lot of patients. There is a use of oral maintenance, but not in a lot of patients. Today we have only the data for the oral azacitidine maintenance in elderly patients. We have no data for the moment for the younger patients, so maybe we need to produce this data. And also there is data after classical intensive chemo, but not after the new intensive chemo like CPX-351. So maybe we have to explore also this part.